Hello everyone. I think most of you need a help in reading section of OET. So I have seen many videos telling that they are giving tips for reading, but actually I was not able to find a single tip in their video. So that's why I made this video which contained real tip. Okay. I will be discussing about the reading part A in this section. So as you know, reading part A will be having 20 questions, which is to be finished within 15 minutes. So part A, we will get 4 different texts, and in which we have one text, it will be in a graph or a table. So in the 20 questions, they have divided it into 3 sections, in which the first 1 to 7. Okay, these questions will be a match the following questions. Then 8 to 14. So these questions will be short answer type. And 15 to 20, the question will be sentence completion or gap filling. Okay. So I will be giving you tips on 2 topics. That is, first, how to understand the question, and then how to identify the answer. Okay. So today I'm going to discuss on this paracetamol overdose, which is given official OET. Once you got the question paper and once the time starts, the first thing you are supposed to do is to identify the headings and subheadings. So in this paragraph, the main heading is paracetamol overdose. In text A, paracetamol contraindications, interactions, special warnings and precautions for use, interactions with other medicinal products and other forms of interactions, etc. So these are the headings and subheadings. Okay, so you are supposed to take at least 30 seconds. So in that 30 seconds, if possible, try to make a note on each paragraph. That means it is not necessary to read the full paragraph. Just what you have to do is write text A, the headings and subheadings. That is, text A contain what all information, contraindication, interactions, warnings and precautions. Text B contains treatment for single overdose. Text C contains emergency treatment of poisoning, and text D contains clinical assessment findings, symptoms and complications. Okay, I will explain what is the real use. Okay, so once you start to read the question, we have to do first thing, we have to understand what is the question. So how can we understand the question? For that, it is necessary to identify the key word of the question. So let's see the first question. The various symptoms of patients who have taken too much paracetamol. So the questions 1 to 7 will be of match the following type. So we have to identify which is the paragraph that contains the specific information. The various symptoms of patients who have taken too much paracetamol, right? So the key word in this sentence is symptoms as well as taken too much paracetamol. Okay, so this is how we identify the keywords. Second thing what we have to do is to identify the key idea. What is the key idea in the sentence? So what is the key idea? This sentence speaks about the symptoms of overdose, paracetamol overdose, right? So now we got the key idea and the keyword. Next step is to move on to the note which we have made. That is, each paragraph contains which all headings and subheadings. So look, in which paragraph these symptoms are mentioned. Okay, symptoms of overdose are mentioned. So we can say it is in the 4th paragraph. Then go back straightly to the 4th paragraph and make it sure. Okay, make sure that the information is given here. So in the 4th paragraph, just read. So once you understood the question, now we have to identify the answer. So we are identifying the answer. So once you identify the correct text, go for skim and scan reading. Never go for deep reading. So because you will not get enough time to read in deep and you will not be able to complete the task on time. Okay, so go for a skim and scan reading. So commonly the patients who have taken paracetamol overdose are asymptomatic. First word, it is about symptom. Second thing, begins to develop the symptoms like pain, jaundice develops after 24 hours. Then at next keyword, The patient may also develop these all problems. So this paragraph contains the symptoms. So it is sure. Okay. Another example, the second thing, the precise levels of paracetamol in the blood which require urgent intervention. So, which all are the keywords of this paragraph? Of this sentence? Precise level. Okay, this is the first thing. Second word, in the blood. Okay, precise level in blood. Next one, urgent intervention. Okay, precise level in blood and urgent intervention. So these are the keywords. Now, then what is the key idea? The key idea here we can see urgent intervention. So the key idea will be, they will be discussing about the emergency management. Urgent intervention and emergency management, both are same, right? So emergency management. So then move on to your own note. Identify which paragraph contains the emergency treatment. Then go on to the paragraph, skim for the specific content and make sure the answer is right. Then write the answer in the given space. Okay. So if you want one more example, I will tell. So we can look on to the third questions, right? The steps to be taken when treating a paracetamol overdose patient. Okay, so which all are the keywords? Try to find. Okay, so the keyword is steps. Okay, steps. Then treating a paracetamol overdose patient. Steps, treating overdose. Steps, treating overdose. Okay, these are the keywords. Then the key idea. So here it is given the steps. So steps can be mentioned only in a diagrammatic way, like a chart or a graph, something like that. So you can, without any doubt, directly move on to the paragraph which contain the graphical representation of the management, right? The steps to be taken when treating paracetamol overdose. So we can move on to the text B. Read the heading, procedure for single overdose. Procedure, step. Okay, they are almost similar with similar meaning, right? So you can make sure that this is. If you want, go for a skim reading. Acute single overdose, then time, first first hour, then what all things we have to do. In each box they have mentioned what are the procedure for management, right? So thus in this way we can make sure the answer, which is the right answer. Okay, I think it's clear for you. Now we can to the second part, that is 8 to 13 question. That questions require short answer, right? So how can we find the keywords for the short answer type questions? Okay, we can check the 8th one. If paracetamol is used as a long-term painkiller, what symptom may get worse? If paracetamol is used as a long-term painkiller, what symptom may get worse? Okay, which are the keywords? If paracetamol is used as a long term, then symptom get worse, right? So the keywords include used long term, what worse? If paracetamol used long term, so used long term and what get worse. This is the keyword, right? Okay, so what is the key idea? They are discussing about overdose, right? What get worse? That is the overdose or the warning. Okay, so in which paragraph that details contained? It is given in the first paragraph itself. Okay, so we can move on to the first paragraph. Okay, we can go for skim reading and try to identify which is the answer. When analgesics used long term. Okay, in the first sentence itself they have given the word. If paracetamol or analgesics are used long term, headache may develop or increase. Okay, so in the short answer type questions, they will be given sentence which are framed as something like synonyms, or the sentence may be of same meaning with different words. Okay, so here the symptom get worse. They have given the worse, but in the paragraph the word which is given is develop or increase, but they can be used interchangeably. Both have almost same meaning. Okay, so you always remember that the sentence given in the second portion will be almost like synonyms with same meaning with different structure. Okay, so we can identify the answer as headache. Then the second question, ninth one. It may be dangerous to administer paracetamol to a patient with which viral condition? Keywords are dangerous to which viral condition. Okay, viral as well as dangerous. So, dangerous and viral. That is what the key idea then. What is the key idea? It is about interaction, right? So, interaction is again in the text A. Move on to the text A. Identify which is the viral condition. We always remember it is a viral infection, not any other kind of disease. So, go to the second paragraph. Other contraindications are shock and acute inflammation of liver due to hepatitis C virus. They have given virus. So, we can make sure that it is hepatitis C. The answer is hepatitis C. Specifically write hepatitis C. Never write hepatitis. Okay. If you want one more, I will explain the next one. That is, we can check the 12th one. What is the 12th question? What drug can be administered orally within 10 to 12 hours as an alternative to acetylcysteine? Once again, what drug can be administered orally within 10 to 12 hours as an alternative to acetylcysteine? So the keyword, what drug, 10 to 12 hours, and the third one is alternative to acetylcysteine. So this paragraph discuss, I think the key idea is about treatment, right? So we can move on to the treatment. Which all paragraph contain the treatment? Second, text B and text C discuss about treatment. So now use the second word. They have specifically mentioned a time, that is 10 to 12 hours. Then search for the word 10 to 12 hours in the paragraph. Okay, so I think we can find the 10 to 12 hours specifically in the paragraph C. Yes, it is given in the brackets. So never miss any brackets. The informations which are given in the brackets are also really important. Okay, so in the text C, they have given, or if acetylcysteine cannot be used with methionine by mouth, provided the overdose has been taken within 10 to 12 hours and the patient is not vomiting. So the answer is methionine. Okay, I think now you are clear with the second portion of the part A. Now we can move on to the third portion. Third portion contains gap filling or sentence completion type questions. Okay, so what is first question? We can check the 14th one. Okay, if a patient has taken metoclopramide alongside paracetamol, this may affect dash of the paracetamol. The keyword, taken metoclopramide. So metoclopramide is the first word. Affect dash of paracetamol. So the key word is metoclopramide. Okay, and another thing, it is discussing about the interaction, right? So which paragraph discuss about the interaction? It is in the first paragraph. So when we skim for this metoclopramide, we can see in the second subheading, interaction with other medicinal products, that is metoclopramide may increase speed of absorption. So the answer is this may affect the speed of absorption, or this may affect the absorption of the paracetamol. Okay. Then the 15th one, after 24 hours an overdose patient may present with the pain in the dash. So the keyword is 24 hours and present, right? So the key idea is they wish to point the symptoms. They wish to point the symptoms. So which paragraph contains symptom? It is in the text D, right? Go to the text D and identify which symptom get worse. Pain in the after 24 hours. So specifically look for the number 24 hours. So hepatic necrosis begin to develop after 24 hours. Okay, so in the bracket they have given right upper quadrant pain. Okay, so it may get worsened. Overdose patient may present with pain in the right upper quadrant, right? So the answer is right upper quadrant. Okay, Then one more we can discuss, that is 17th one. Acetylcysteine should be administered to patients with a paracetamol level above the high risk treatment line who are taking any type of DASH medication. Okay, so the keywords to patients with paracetamol level above high risk treatment. Okay, above high risk treatment line. Okay, then with any type of medication. Okay, so the answer will be a particular name of drug or a group of drug. Okay, so we have to look for the high risk treatment, that is the emergency treatment. Okay, emergency treatment is in the text C. Then go to the text C and try to search for any name of drug. Okay, in the text A there is given acetylcysteine, but it's not the answer. Then they have given methionine. Then another one, patient on enzyme inducing drugs. Okay, or malnourished should be treated with acetylcysteine if their plasma levels is above high risk treatment line. So the answer is enzyme inducing. Okay, enzyme inducing is the answer. So I think you are clear with almost the 3 sections of this reading. So this is the real tip. So first, understand the question by identifying the keyword and the key idea. Then move on to the paragraph. Then identify the answer by skim and scan reading. If any number is given in the question, specifically search for the number. Otherwise, if we identify that the question requires an answer in number form, search for numbers. Okay. Then one more thing I wish to tell is about the time management. It is better to fix a particular time for each question. Since we have 20 questions and we have 15 minutes, it is better to finish each question in 30 seconds. Okay. So if you are unable to find the answer in 30 seconds, leave the question. Do not go back. Okay. Do not try to find the answer for the same question, spending more time. It will waste your time and you will not be able to finish the whole questions in the given time. Okay, so what you can do is leave the question. Put a mark on that question. Okay, once you do the other questions and reading the other paragraph, you may find the answer for the question which you skipped. Okay, it happens. It works. So don't waste time on the answers which you were not to identify. Okay. So focus or try to do the next questions, and when you try to identify the answers for the other question, you may be able to find the answer for the question which you skipped. Okay, this is the another tip. Okay, so and one more thing, if you can do, try to practice by setting, not by setting 15 minutes, try to do within 14 minutes. Okay, so that it will improve your time management. Okay, I think this is really helpful for you. If you have any comments, please mention it in the comment box. And if you felt this video was good, please do a thumbs up. Thank you. Hello everyone. So I think most of you need a help in reading section of OET. So I have seen many videos telling that they are giving tips for reading. But actually, I was not able to find a single tip in their video. So that's why I made this video, which contains